everybody. Thank you for coming today to get an update on COVID-19 in King County. I'm Hillary Karras.
I don't know who the fuck that is.
County, and I would like to first introduce our director, Patty Hayes.
Good afternoon. I'm Patty Hayes, Director of Public Health, Seattle, King County. I want to thank everyone coming today and joining us as we share an important update on coronavirus here in King County. I'm joined today by Dr. Jeff Duchin, who is our Health Officer for Public Health, Seattle, King County, Dr. Kathy Loki, who's the Washington State Health Officer, Dr. Frank Rito, who is the Medical Director of Infection Control at Evergreen Health Hospital, Dr. David Knopfler from Overlake Medical Center, and our King County Executive Giles Constantine. So with that, I'll turn it over to Dr. Duchin for the initial update.
Thank you, Patty. Thank you for joining us this afternoon. Today, Public Health Seattle King County is announcing 3 new presumptive positive cases of novel coronavirus, COVID-19, including one person who died. And I want to just start by expressing our deep and sincere condolences to the family members and loved ones of the person who died. 2 of the confirmed cases are associated with Life Care Nursing Facility. It's a long-term care facility in Kirkland, Washington. One is a healthcare worker from Life Care. She's a woman in her 40s. She's in satisfactory condition at Overlake Hospital, and she has no known travel outside of the U.S. The second case is a woman in her 70s, a resident at Life Care, the long-term care facility, and is in serious condition at Evergreen Hospital. In addition, we're aware of a number of individuals associated with the long-term care facility who are reportedly ill with respiratory symptoms or pneumonia, and we're in the process of investigating this situation as an outbreak. We're in the beginning stages of our investigation, and new details and information will emerge over the next days and weeks, and we'll keep you updated. The person who died was a patient at Evergreen Hospital who had underlying health conditions. He was a male in his 50s. He was not a resident of the long-term care facility. We are now in the process of working with the long-term care facility with the support of the Centers for Disease Control and Prevention. Our CDC colleagues are coming out. We have a team arriving tonight. We'll have additional help on the ground from the CDC tomorrow. And we're in the process of providing support to that facility to care for the infected patients, to protect the uninfected patients, and to provide infection control guidance for their staff. At this point, I'm going to stop and turn the podium over to Dr. Kathy Loki, who is our State Health Officer. Actually, before I do that, Kathy, let me just remind people a couple of things. First of all, novel coronavirus infection, as has been recognized, is spreading globally. And we are having increasing cases in the United States, and we expect to see increasing cases locally. It's very important for everyone to remember that 80% of the cases are mild. Patients frequently don't even need to seek health care. You can think of it as a bad influenza-like infection. However, as these recent cases demonstrate, it can be severe. And we want people to understand that there are things that they can do to protect themselves from getting this infection, just as we can do things to protect ourselves from getting influenza. Hand washing, more hand washing, less face touching. Staying away from others who are ill. Please don't go to work or school if you yourself are ill. We can think about what might happen if we see more cases, which would mean possibly telecommuting, businesses having fewer people coming into work, either because they're sick or they're trying to minimize face-to-face interactions. Social distancing that we will recommend so that people put more space between them and others so they're not likely to get sneezed or coughed upon. So there may be times when we would ask people to avoid going to large gatherings, to avoid congregating in public settings like sporting events, social events, and so on. But at this point, we do not have widespread community-wide transmission locally. We have transmission that's associated with an outbreak at this long-term care facility. So we're going to be watching the situation very closely, and we're going to be providing guidance as we learn more. At this point, I would say everyone should take the basic precautions: hand washing, more hand washing, less face touching, social distancing, not going to work or school when you're sick, staying home when you're ill, thinking ahead as to what might happen if people in your family become ill, how you'll care for them, if children are dismissed from school, who can watch them, if you've got people in your home who are older or vulnerable, how you'll take care of them, if we have social distancing and people are requested not to go out frequently. Have medications in your home so you don't have to go out and refill a prescription if you don't need to. Have some foods that you like to eat handy so you don't have to go to the store if you don't have to go out and be interacting with other people and touching other surfaces. And finally, it's really important to know that as with seasonal influenza, the people who are at greatest risk for novel coronavirus infection with serious outcomes are elderly. So we will say, as we do with influenza, over 60, over 65, and who have underlying health conditions, chronic cardiac disease, lung disease, diabetes, and the other conditions that we're concerned about with influenza. Pregnant women, perhaps, people have weakened immune systems. These people in these groups really need to pay attention to the guidance about hand washing, not being around ill people, and trying to minimize social interactions at this time to the greatest extent possible. So with that, I'm going to introduce our State Health Officer, Dr. Kathy Lofi.
Great. Well, thank you, Dr. Duchin, and good afternoon, everyone. My name is Dr. Kathy Lofi. I am the State Health Officer at the Washington State Department of Health. I want to begin by echoing the sentiments from those who have spoken before me. We send all our deepest condolences to the family of the person who died. We also want to extend our support to the healthcare workers who are caring for impacted people at this healthcare facility where COVID-19 has been confirmed. I'm going to now echo, I think, some of the comments that Jeff made. The COVID-19 situation is rapidly evolving on the global, on a global scale. And in Washington, we are starting to see some spread of this virus. Therefore, we do feel that the risk to the general public is increasing, but as Dr. Duchin said, we do not feel that the risk, that transmission is occurring on a widespread basis by any means. Therefore, this means that it's more important than ever for people to practice good health habits, such as washing your hands and staying home from work and school when you're sick. Should we start to see more spread in Washington, we might consider some measures such as canceling large public events, but don't really feel like that is the situation we're in now. Now that we can test for COVID-19 at our state public health laboratory in Shoreline, we're able to get the test results back much faster. And this will allow us to identify cases and offer key guidance to impacted communities in a more timely fashion. And in closing, I also just want to reiterate that it's important for people to remember that most people with COVID-19 do have mild illness. A smaller proportion will have severe illness, and that is why we are working extremely hard to try to decrease the spread of this virus in Washington. And with that, I will turn it over to Dr. Frank Rito.
Well, Dr. Francis Rito, I'm the Medical Director of Infection Control and Prevention at Evergreen Health. Evergreen Health is a public hospital district that serves Northeast King County, South Snohomish County. We're a community-based hospital. With the updated guidelines for testing, we initiated testing in 2 individuals who we felt had high risk based on symptoms alone. There was no epidemiologic link to travel, and both of those individuals tested positive. That initiated a cascade of events, and at this point, really close cooperation with Seattle-King County Health Department, with the State Department of Health, with the Centers for Disease Control, and with our Northwest Healthcare Response Network. We are continuing to care for the individual who has survived. We express our condolences to the families of the individual who has passed away. We have additional individuals that are being tested, and in conjunction with the State Health Department and the State Lab, we should have additional information later today. I want to thank everybody who has participated in our effort, and it's been a big shift. We'll take questions later, and I think I'm going to introduce Dr. Mr. Don Constantine. Thank you.
Thank you, Doctor. I want to begin by, on behalf of the county, expressing our condolences to the family of the patient who passed away, and our thanks to the healthcare workers who are helping keep our community safe. With the rapid developments late yesterday, I was in Washington, D.C. for a presentation I was making at the National Association of County Officials. I canceled that and got the first flight back this morning because we are rapidly shifting our operations here to be focused solely on, primarily on dealing with this crisis. And of course, public health is taking the lead on making sure that the community has the right information and that we are doing all the carrying out all the best practices community-wide, but we also have to focus on our King County operations and the some 19,000 employees who provide a huge range of services and infrastructure across this county on a daily basis. I want to commend the professionals of public health for their around-the-clock work in recent weeks and for their work as we prepare for the long days ahead. The community relies on these dedicated public servants, including our partners at the state, and I want to thank them as well. Counts on them to rise to the challenge of a public health crisis, and they have done so, and they continue to do so. And you've heard how we are responding to the emergence of the COVID-19 virus in our community. Now, in addition, we've activated the King County Emergency Operations Center to support public health, as well as to help coordinate the work of cities across King County. The primary role of the Emergency Operations Center is to provide regional coordination in support of county and local operations, to collect and process and to disseminate situational awareness, and to coordinate resource management for King County and our regional partners. The EOC is currently activated at the enhanced level, meaning we have King County emergency management staff on site at our facility in Renton. The EOC will be staffing, will also be staffing a liaison with Public Health and Medical Area Command, which is in this building, and many of you have had a chance to see that operation over the course of the last few weeks. And that will help ensure tight coordination between all the players. I have directed my department directors to move swiftly with preparations for county operations, and I want to talk about how a few of our major departments are responding. Metro Transit established an incident management team to develop policy recommendations, specific operational strategies, and protocols for sustaining Metro operations in all contingencies. Metro will look to public health for guidance on any potential operational changes. Currently, if there are reports of unsanitary conditions in any of our buses, Metro will immediately pull that bus from operation and sanitize the bus before it returns to the streets. Metro cleans and vacuums each vehicle every day and routinely cleans interior surfaces, and that obviously will continue. To echo what we've been hearing from public health experts, we need to emphasize personal health preparedness and riders not traveling when they're sick and covering coughs and sneezes and washing hands. Now, in terms of our homeless response, King County, the City of Seattle, and Public Health's Health Care for the Homeless Network have scheduled 4 trainings so far to review and answer questions about best practices. Trainings are going to be provided in Kent, in Seattle, in Shoreline, and in Issaquah. And shelter providers have been notified of these trainings, and they are strongly encouraged to send staff. The Department of Community and Human Services and Public Health's Environmental Health Division will implement a monitoring schedule to ensure compliance with our guidelines. King County and Seattle Homeless Program staff are updating and confirming addresses and contact information for every shelter, day center, encampment, transitional housing facility, and permanent supportive housing program to ensure the swift sharing of information. Finally, King County's Department of Community and Human Services and Public Health are working with the county's Facilities Management Division, and the directors of each of those agencies are here with us today. And the Facilities Division oversees all county properties. We are exploring options for people who are homeless to rest and recover from COVID-19 away from others in shelter situations. So we want to continue to monitor this situation, and we will return with updates as needed. Thank you, and now I will reintroduce the Director of Public Health Seattle and King County, Patty Hayes.
Thank you so much, Dale. Before we move to questions, I just want to reiterate a couple of things. You've heard a lot of the details of this emerging outbreak this afternoon. I want to share with you my gratitude to the extraordinary professional staff we have here at Public Health Seattle King County and the incredibly hard work that they are engaged in, as Dale said, on a 24/7 basis. Our team of frontline investigators, medical science staff, emergency response, nurses and communication, we're a strong, committed bunch of folks, and we're here for the community. And we've been eternally grateful for the partnership with facilities and the quick response that we had with Evergreen and Overlake and the facility. It's by working together and keeping together that we do the best for our community. Work like this is going on across the country in every local public health department. I've been in touch with a number of my colleagues from the large cities, and people who are doing this work are working to make sure that as we move forward with the spread of this virus, that we are taking the right and good steps for our community. I so appreciate our elected leaders, the scientists at CDC and our state health department for their strong support of this work. Everything is local, as we know, and the support from our other parts of the public health system is essential. We need to make sure that we're based in science and the public health practice. At times like these, we need people at the highest level of government who are committed to truth and science accuracy. The situation, I know, for lots of folks feels very scary. And it's a natural thing to be worried about this, and that's why we're continuing to put information out and to be as transparent as possible as we move forward in what we learn about the virus so that we can shift strategies as it's needed. We are a strong community here in King County. We will stay united and informed. If we do that, we can get through this together. With that, I'm going to open it up for questions, and Dr. Duchin will be helping facilitate that.
Thanks, Patty.
Legislator in Brooklyn said that their associates and residents were diagnosed with COVID while receiving care in local hospitals. Does that mean you think that the transmission occurred in local hospitals?
Well, thank you for your question. No, our colleagues at Evergreen, I really want to give a lot of credit to Frank and all of our healthcare provider colleagues who are working to screen patients for the symptoms of this disease and to contact us when they suspect they might have cases. But these patients were identified after they were admitted for respiratory disease at Evergreen. They were not, we don't have any evidence that they acquired it at Evergreen, and our investigation into this outbreak is in its very earliest stages. It's just happened. But we don't have any reason at this point to think Evergreen is where these patients acquired their infection. I don't know, Frank, if you want to comment any more about that?
No.
Okay.
When you said there were 3 cases total, and the press release spelled out 4.
Yes.
Can you clarify, please?
Yes, the press release was including the case we announced last night, which you may be aware of, a woman who had traveled to South Korea, who is also at home doing very well, did not need hospital care or health care of any type, self-managed, and is recovering.
Can you talk about some of the precautions?
Suzanne Fong with Como TV. In California was the very first case of person-to-person transmission that was announced earlier. Any of these cases show potentially person-to-person transmission?
Well, none of these cases traveled, so our assumption is all of these cases were acquired from a person. So yes, these are cases that they acquired them from another person. That's pretty much how the disease spreads from person to person. I think maybe what you're referring to is community-acquired transmission. Yeah, Yeah, we believe that these are cases of community-acquired transmission acquired here in King County. And what that says to us is as we test more, we'll likely find more cases of this disease because most of them are mild and aren't seeking health care, or if they seek health care aren't having a severe illness that qualified for testing based on the previous testing criteria and the current testing criteria. So our assumption is that when we see severe cases in a community, there are other less severe cases as well. But we don't have any data to support that at this time. And as we test more, we'll probably identify more cases. And that's why we're really starting to emphasize the importance of these community mitigation measures, which are social distancing measures that are steps that everyone can take to reduce their risk of becoming infected, because we expect this infection will increase over time. And so we know we can't stop it. It's here, and it's going to be here with us in the U.S. for quite a while. But we can reduce our risk, and our focus is on reducing both the risk to individuals of getting sick, but also the risk to our community as a whole. And so the steps that we mentioned before about individual actions to prevent illness in yourself by having good hand washing and not touching the eyes, nose, mouth, and face, by avoiding contact with ill people, staying about 6 feet away from others in general if you can, and not going to work or school when you're ill, and having a pandemic preparedness plan. And there's some very good resources available for the public on pandemic planning. You can Google CDC, NPI, non-pharmaceutical interventions, and get a nice summary of measures that are recommended for individuals, schools, and businesses. There's good business planning that's been issued by the CDC, and there will be, over the next couple of days, additional specific guidance coming out around pandemic planning. But it's basically be prepared at home, be prepared to take care of those in your home who are ill, and those who might need special care, older adults or people who have special needs. Understand what you'll do if someone's sick and can't go to school or work, how you'll manage in the home. Have neighborhood support. Know your neighbors and what your community organizations can do for you. That's incredibly important as well. And for all of our businesses, start thinking now about how you can reduce the contact that your employees will have with one another over the coming weeks to months, should we need to ask you to do that. So telecommuting, distance meetings, minimize face-to-face gatherings, and we will also be considering things like cancellation of large public events if we see more evidence of spread in the community. But at this time, it's really important to understand this is a focused event in one long-term care facility in one region of the county, and at this point, we're not asking for large-scale cancellation of public gatherings. We're asking for personal responsibility. Get informed, don't panic, get prepared.
Dr. Duce, can you talk about the criteria for testing? It used to be if they had traveled to China, things like that. Now, obviously, those have to change because we're getting so many cases where these people haven't traveled.
Yes, so testing capacity is still limited, although we're very grateful that our Washington State Public Health Laboratory is now testing locally. There's still a limit to how many tests that one laboratory can run, and so we're hoping to have more testing available in the community in the coming days to weeks through commercial laboratories, perhaps the university laboratories. But at this point, we've followed the CDC guidelines for testing. They have criteria, so if you've traveled to an area where there's community transmission occurring and you've got certain symptoms, you can be tested. And if you've got severe illness, such as our patients at Evergreen had, even if you don't have a history of travel, you can be tested. And that's how we uncovered the local cases, by dropping the travel criteria and testing patients who had an illness that was serious.
Dr. Duce, can we talk about those first responders who may have transported that 70-year-old to Evergreen or responded to that care center in the last week or so? We've heard there's been some quarantine done with some of those firefighters, Kirkland, Redmond. What can you tell us about your recommendations?
We follow up on all persons who are exposed to known confirmed COVID-19 cases and do a risk assessment to understand whether they're symptomatic, have symptoms that might be worrisome, require isolation, or asymptomatic, feeling well, and can self-monitor their health for 2 weeks. With respect to the healthcare workers that, and this is not unique to first responders, but even in our healthcare facilities, patients sometimes may come in and not be recognized as possible COVID-19 patients and then later be found to have the infection. And so what we do is we work with the healthcare facility or the first responder agency to understand who was in contact with those people. We connect with them or have their agency provide guidance around symptom monitoring and what steps to take should symptoms develop.
This might-
You said you can do it locally now. Does that mean that CDC no longer needs to sign off and confirm these things? And could you describe the backlog in
Sure.
testing and how big the backlog is?
Sure. So we started testing in our state public health laboratory just yesterday and are gearing up our team to be able to test specimens around the clock, 7 days a week. As Dr. Duchin mentioned, our capacity will be limited at some point. So that's why it's so important that we really can help to get some of these commercial labs doing testing. We are going to, we do have the authority now to decide what we want to test and what we don't want to test. We still are largely following the recommendations from CDC as to who to test. But if we have extra room to run additional samples, we're going to be doing as many tests as we can.
Dr. Lofi.
How many tests have you done?
Oh, and we do not have a backlog right now. I don't know exactly how many tests were run yesterday. We have no backlog. We tested we're able to keep up with all the specimens that are coming in at this point.
How many can you do?
Yeah, so we are working up to testing about 200 specimens a day. That is our plan, and we hope to be at that capacity soon. As you know, should we start to see more spread, we will need more testing capacity, and also that's why we're also working very aggressively with some commercial labs too, to make sure that there are other labs that can test as well.
What would trigger the state or the county's decision to cancel large public gatherings? And could you explain the other authorities that might come into play if transmission were to spread, curfew, quarantine, et cetera?
Yeah, that's a good question. And we actually have a whole team at the Department of Health that's now really thinking about these questions. They're hard decisions to make, and I'm just going to be frank with people. If we get to the point where we have to cancel large events, close schools, these are not, insignificant, measures to take. So we are really putting our best brains together to really think through, what are the things that we need, what are all the things that we need to consider? And some things that we would consider are, first of all, how widely is the disease spreading, how much activity is out there. We have a lot of data systems we use to monitor influenza in our population. That we can use to monitor, that we use to monitor how many people are coming in who are being seen in emergency rooms in urgent care centers with fever and respiratory symptoms. So we have data sources that we can look at. We'll now have more testing, as we talked about. Other things to consider, we're learning more about the severity of the illness every day, the transmissibility, and then there are a number of other things to consider, like our healthcare system. Is our healthcare system able to sort of keep up with patients who are, coming in and need to be seen? So that's just another consideration as to when we might, recommend some of these community-based social distancing strategies. But all of this is really being, really thought through right now with working really closely with a number of our elected officials.
Any indication that there's any connection between all of these cases in this facility and in the Kirkland area to the teenager who we heard about last night?
Oh, the teenager from Snohomish County, we are not aware of any connections between these patients at this time.
Dr. Riedo, a follow-up question for you, please, regarding the individual who died. Can you tell us more specifically about his underlying conditions, or perhaps where he came from, and where he was in the hospital?
The individual, someone with a significant number of comorbidities. He was a chronically ill person. It was a man, and beyond that, I'm going to respect the privacy of the family and the patient. But it was somebody that had underlying risk factors for severe disease. It was one of the things that prompted us to test him because of that. We felt he was at a higher risk and had an unexplained respiratory infection.
Did he come in at the same time as the woman came in from the care center? Were they connected at the hospital at all?
At the present time, we do not see a connection between the two, but there are some evolving threads that are being investigated.
Doctor, is his family now being told to quarantine? Were they caring for him prior to him coming to the hospital?
The family is aware of the diagnosis, and the family has been counseled on appropriate measures, and they're being followed up as contact tracing, and appropriate measures will be taken in conjunction with Seattle King County Health Department.
Doctor, this healthcare facility, were they taking the full precautions recommended by the CDC at the time of this outbreak there?
I'm not sure which healthcare facility you're speaking about. I can't speak to Life Care.
Dr.
Can you guys
Dugan,
talk
answer
about
that?
the fact that yesterday morning there was no King County cases, and now there's 4, a death, and possibility of dozens more, and like what we're going to expect for the next?
That's a great question. I'm happy to address it. What prompted us to start looking is the change in the testing criteria. So the Centers for Disease Control had recommended testing only for individuals who had a travel history or a known exposure to someone with COVID-19. Tuesday or so of last week, the testing criteria changed, and there was a line that included testing for individuals with severe respiratory illness, no other explanation, and no history of travel. So it was on that basis that we opted to look at 2 of our most critically ill patients in the critical care unit and to initiate a testing algorithm. That was started on Thursday night. The tests were sent out yesterday. We're very grateful for the Department of Health, who now has the testing capacity here, rather than having to send it to the Centers for Disease Control in Atlanta. And with that information, we were able to gain the rapid response. I think the fact that there are patients now being identified locally has to do with that increased testing capacity and the change in the definition for who can get tested.
So it's possible though for like the last month there's been dozens of cases that we just haven't known about.
I think they're, like anything, what we're seeing is the tip of the iceberg.
Right.
So we're seeing the most critically ill individuals. Usually that means there's a significant percentage of individuals of less severe illness floating around out there. And yes, so in all likelihood there is ongoing low-level transmission. We don't have the epidemiologic link to figure out exactly how these individuals were infected.
Doctor, what are you doing to prepare at the hospital? Do you guys now have some sort of a quarantine area for somebody who shows up and says, I feel like I might have this? Or, I mean, what are you doing to keep those people separate? Have you done any actual changes at the hospital?
So we have engineering capacity at the hospital to turn half of our critical care unit into an airborne precaution center. So basically by reverse engineering airflow, we can isolate an entire portion of the critical care unit. The individuals that are under investigation are currently cohorted and are all in negative flow and airborne precautions.
Dr. Rito, you had said that there are additional test results expected later today. Do you know approximately how many those are, and are those all patients at your facility currently?
We have a number of tests that have been submitted, and we will continue to submit tests to the Department of Health lab. They obviously work on their schedule. We hope to have those results later today. We'll be working with Seattle King County Health Department once that information becomes available.
And how many have already submitted?
Yeah.
I'm sorry?
I can't speak for Overlake. We have submitted a number, and we have some additional individuals that we're looking at today. Evergreen, yes, thank you.
Nicole Jennings, Cairo Radio. Questions that I'm seeing from listeners are, lots of people, especially the elderly and those with compromised immune systems, die from the flu every year. Why the increased concern over coronavirus?
I could take a stab at this, and then I'll let Dr. Duchin respond. So the difference between this coronavirus and influenza is, first of all, it's a novel coronavirus, so there is no innate immunity to this. It's a completely vulnerable population. Second is there's no vaccine to prevent it. And we strongly encourage people, even now, to go get their flu vaccine, because it will still prevent influenza, prevent that morbidity, and keep you out of the hospital system. And the third thing is there is no currently effective antiviral therapy for SARS-CoV-2 or COVID-19. So with all of those things, it's a perfect storm for a novel virus to come out without vaccine, without population-based protection, and without an effective therapeutic agent.
I think we can take one or two more questions.
Has the CDC issued new numbers now with including all your cases on the number of cases across the country now? We got updated numbers on?
The CDC had a conference this afternoon where they discussed our new cases, and I assume that their webpage will be revised to reflect the numbers that are current here and also in other states that have been changing recently.
What kind of investigations are you going to be doing going forward to see exactly how this got transmitted in Kirkland?
Yeah, thanks for the question. So we have a large investigation ahead of us, a complicated investigation ahead of us, and we have requested assistance from the CDC, and we have a team coming out tonight. At least 10 CDCers will be joining us tomorrow, and possibly more after that. And what we're going to be doing is helping the facility really to go through all the information they have about the patients they've had in that facility for the last month, the symptoms they had, the onset date of those symptoms, what were the symptoms, who cared for them, did the patient get sick, were they diagnosed, testing the patients in the facility who are ill now, then testing the ones who are well, testing the healthcare workers, interviewing the healthcare workers, and then the contacts of anyone who is ill. So that's the nature of the investigation. It's basically defining the cases in meticulous detail, defining their connections to one another, and looking at their contacts for possible transmission.
I know you said the CDC is on the way here. Just one quick follow-up. Are you guys already out there helping the facility right now?
We've been working with the facility since we found out about this in consultation with CDC remotely from a distance to get the best advice we can to them in the interim, and we'll be providing more advice as we learn more about what's happening there.
Before you guys open, can we give numbers for the state, current number of cases and current number of cases?
Hold it all up.
Sure.
This is the last question.
So currently we have 6 cases. The other thing that the people should be aware of is that when we now do testing in our state public health lab, we do call those presumptively positive. Those specimens do need to be sent to CDC for confirmatory testing. But if we include those presumptive positives, we have a total of 6 cases here in Washington State. 2 of those are residents of Snohomish County, including our original case. That was the first one reported back in January. And 4 of those are residents of King County.
And testing?
I don't have the exact numbers in front of me of how many total patients have been tested, but we can certainly get that for you.
How many have the CDC actually approval on that presumptive of this number?
They have not approved any of the specimens that have tested positive in our lab yet.
Even January?
Oh, the January one, yes, that was
The old
tested
one.
at CDC. That is correct.
Thanks so much, everybody. Thanks for coming today. We appreciate it. Thank you.
So you should be a public health now. Frank, you only went for
Thanks, everybody. I think we were distributing a slightly updated